as we have a little bit of time, it's with great pleasure that I get to introduce this next session, which is very near and dear to my heart, as I'm sure it is to any business that survived 2020. This was such a strange experience. Is if many of you have had a pandemic plan or thought you had a pandemic plan, it took 2020 to instill some humility in all of us to just determine how inadequate that pandemic plan probably was, most likely because of the 2020 COVID-19 experience. So I think this is just such a great resource tool that, and kudos to Tom Moran and the group for putting something like this together. But that this next session I think is going to be extremely important. Looking forward, and the tentacles for this next session really goes, I think, well beyond the COVID experience. I think we can expand it, and it more than likely will be expanded to include everything from hurricane disasters to snow blizzards to, civil unrest. There's going to be some shortages of personal protective equipment in some way, shape, or form. So to the extent that we have a resource such as this to allow us to get access to a vetted exchange program, I think it's going to really pay dividends for all of us. So this next session is really a national vetted PPE or personal protective equipment exchange program or resource program and training that was put together. We're going to learn a little bit about this sourcing model for PPEs that was developed jointly by the state, federal, and industry stakeholders to address the PPE shortage that the nation really experienced during 2020. So this session is going to include training on how it was developed, its current state, looking forward, the future resources that could potentially be added, and how you can leverage it for your own organization. And I know, so we've got, let's see, John Molnar, you and Dan Scully. I'll let you guys introduce yourselves and pass it over to you to kind of discuss with the group what this program is all about.
Not a problem. I'll just be brief. You've heard from me enough today, but if you haven't, I am John Molnar. I am the director of the AHC's Program Management Office, sort of Tom Moran's right-hand man. Tom builds the collaboration efforts that are done, works through the use cases, and then he gives me the solutions to make them work. So that's sort of the team effort that we work on with a plethora of people behind us that are helping getting these things done. As you can imagine, it's just not two guys getting this together. We probably have 35 people that are working through these efforts on a daily basis. One of my co-workers here on this project that has been one that has tested it out and actually utilized the PPA exchange is Dan Scully. Dan, if you could just give a little bit of a highlight of yourself, I'd appreciate that.
Sure. Hi. So my name is Dan Scully. I am the Deputy Director with Lancaster County Emergency Management, Pennsylvania. And I was actually introduced to this program through George Giangi. So I was given a report out of some efforts I was taking behind the scenes to help find PPE. It was very time consuming. It was a successful program, but there was a lot that went into it, a lot that went into trying to keep it maintained, and a lot to go in every time you put a request in there to find PPE. So I guess we're one of the newer users on this. I've had a couple real world incidences of putting out the requests, and I was extremely happy and saved myself hours and hours of time.
And so I'll get started with some of this. I don't know if we'll take the 40 minutes or not, but I hope to at least give you an idea of what this tool was about, and to be dealing with this. Again, Let me make sure I have the right slide. Sorry, guys, I have the wrong slide up here. I figured something was wrong there looking at that. All right, bear with me. That's what I get for using
Hey,
five
while
slides.
John is bringing that up, I know I've got a number of inquiries from businesses in the South Central Pennsylvania region in order to order, for example, N95 masks and gloves and sanitizers and so on. They had to deal with unknown vendors, some of which may be from foreign countries, requiring 100% of the upfront costs. You don't know if you're dealing with counterfeit. You're not sure if you're going to get them on time. In some cases, it was a 30 to 60-day delay in getting them in here. So there was a real, a real need for some vetted program to be developed. And necessity is the mother of invention. So I think that's what precipitated this program to even get started.
Sorry, guys, I'm struggling here. I should have. Hmm.
John, do you have a PowerPoint that you need to bring up?
I do. I have it
Okay.
right here. I just cannot get the right slide up. There it is. Sorry, guys.
No problem. No problem.
Pressure was on and I failed miserably here. All right. The one of the things that I wanted to get sort of zeroed in on with the PPE program that the AHC has developed here is that, why did we develop this thing? And after listening to the AHC for 2.5 days here of the attendees, hopefully you understand now that if you didn't get one thing out of this whole 3 days, that the AHC is a collaborative effort that facilitates public-private, issues and serves basically at the beck of the government and industry and trying to help those organizations. And we utilize that through a use case type of an environment. So, I mean, you've heard 20 different initiatives here that the AHC is working on through this use case area. And the PPE environment really came out of that issue. Hey, the government, the industry, the private sector was having a problem. All of a sudden PPE became a big issue, and how could we develop an ability and a mechanism to provide products and services that were difficult to find in a time of need and scarcity. And this happens to be the hopefully the flavor of the day, and will cease to exist in 6 months or 8 months when this is no longer necessary and we go on to different things. But right now the PPE is an issue and we were dealing with it. And the point of it is how can we bring people together that have the needs with the resources that have the product? And those are really the two things that we were trying to get together in this initiative. And that what the initiative was not, though, and what I wanted to call out is the PPE exchange is not a procurement, an auctioning, a strategic sourcing application. That is, we don't have the manpower, we don't have the wherewithal to build a procurement system. That is not what we are trying to do. All we are trying to build out, and I think Dan can talk to this as we go forward, but one of the big things is the complexity of just bringing the sellers and the buyers together to solve one simple problem. Do you have what I need? Do you have when I need it? And do you have what I'm looking for and at a price that I can deal with? Yeah, I mean, that was really all we're trying to get together and see, and then moving that into their internal procurement system or anything else is really what all we were trying to provide within this use case. So hopefully you understand what I'm saying, because everybody understands, I believe, if you've been in industry at all, procurement systems are very expensive, they're very complex, and we are not dealing with anything like that in regards to the integration activities here. So anyways.
Hey, John,
yeah.
if I can add, I think Tom says it best when he compares this model to an Uber model.
No, that's exactly right. Yeah. We'll
Someone needs a ride and someone can provide the ride.
Right. The next slide is, how can we find it faster and safer? And we tried at the very beginning, and we can tell you some of the stories that we screwed up on. And I think everybody kind of loves misery at a point, and everything's not perfect. And we didn't come about this in a very straight line to get to the very perfect solution at this activity. And as we talk through that, you'll understand what I'm saying. The first mechanism that we tried to resolve is, well, where are all of the PPE suppliers? And how about if we just buy the listing for PPE suppliers? I can see there's distributors over on the medical side, and I can see there's distributors on the construction side. And they're sort of two different areas, but they both kind of utilize the PPE areas, whether it's masks, whether it's shields, whether it's the gowns, whether it's all this different type of equipment. These types of distributors are finding that type of equipment, and they have two different subsets that you could pay for in regards to those sellers that are in that marketplace. So our very first trick, and again, I'll tell you some of the gritty details here, that we bought two of these data sets, one on the medical side, one on the construction side. And they both pretty much were fairly equal, about 18,000 vendors in each of those areas for 36,000 vendors that we had on this on our database. And we spent probably $15,000 on that website and said, man, we will resolve everybody's problem, because we'll just give them the database and we'll just give them all these vendors, and that'll solve every problem they have. Well, I think you start realizing we didn't understand the issue. I mean, that takes a ton of work. And in the procurement area, people are busy and they don't have time to look at 37,000 vendors to figure out where they are. And we sat there and said, well, we just blew $15,000 on ready, fire, aim type of solution set that we didn't understand what our customers were even asking us for. So how can we get that in a way, as I mentioned to you right at the start, to answer a simple question? We weren't listening properly at the get-go, that our constituents were just asking, do we have the right suppliers? Do they have the right products? Can they deliver as requested? And is the price in the ballpark? And if they can deal with that and find 3 vendors that had it, that nobody else could find, because their initial suppliers were out of stock and they were in a bind. That was the issue, and they weren't looking at the map that this beautiful map with our 37,000 suppliers, that they would have to go down and look at each freaking dot and check it out and say, that's the one I want to use. I think it was just the wrong approach that we did, and we made it harder instead of easier. So that's where we started building the PPE exchange, and started seeing now that that the COVID increased the PPE demand. The current providers that had master contracts within the private sector as well as the government sector in the state areas, they didn't have the quantities that were necessary. You saw the risks of fraud and trust issues that we were dealing with. So how could we get, as George had mentioned, this Uber model to expedite trusted PPE requests within minutes? And the Uber model, just as sort of George had mentioned, is you send an automated request out, you receive feedback in a minute, and then you decide if you're going to take that driver or not. And that's really sort of what, Tom's focus was on that Uber mechanism. How do we get it that that the buyers can quickly decipher who has the equipment, what's the best deal for them to utilize, and can they move forward with the buy so that they can find the holes that are in their PPE equipment. The other thing that we did that you'll look at is that our suppliers, the competitive responses that we had to deal with, where we cut them way back from the 37,000 to be specific within the PPE distributors that actually dealt with that equipment within that area that was in the United States, that were dealing within the United States, that had emails that were legitimate, that were not subjective or anything, that we could actually deal with real people, with real names, and have those types of initiatives that we could send emails out to and get responses back within 10 minutes, 30 minutes, a couple hours or whatever that would take. And it started, and so that cut back the 37 all the way down to about 6,500, which again, regardless, I think as you could tell, any type of buyer was not going to have a database of 6,500 suppliers that could answer any of their questions regarding the various types of equipment that they were dealing with. The next slide. Sorry, guys. The next slide kind of gets into that whole mechanism, and the area that we were dealing with that really, again, we were dealing with the research issue. Okay, we found the 37,000 suppliers. That's great. But we weren't going to be able to handle the outreach until we built this Uber model. And what we were trying to resolve then was this whole, a week, 2 weeks, whatever it would take to find the research, the outreach, to compare the sources, select the sources, call the emails, follow up, submit the request, deal with this section here, and try to get a system together that then they could, the buyers could incorporate within the competitive offers and handle the Q&A just like they would in a half hour's time, that they could get the bids together within 3 or 4 competitive offers that they would have within this PPE environment. And that was what the people were listening to. That's what your buyers were listening to. And Dan, I think those were the types of questions that you were really trying to resolve within that time frame. If we understood what you were trying to do within this exchange. So going over that, how the system works, just going into that, you have to be a member to join this system, okay? So you have to have a login, you have to have a password, you have to log in within this website to get into the PPE. It's just not willy-nilly, it's just not everyone. These are trusted partners. It is our environment, it's our participants that can obtain this type of selective area that you gain as part of the AHC. On the buyer side, when you are a buyer and asking for this type of stuff, we make this as simple as possible. There's activity counters to show how much activity is regarding your buying activity that you have, your responses that you have within this. There's the left side navigation dealing with the reports and stuff, and then telling you how much activity your vendors have within this type of area to see if you're getting any activity regarding your results or your requests for PPE equipment. And again, we made this as simple as possible. We were, again, not trying to build the whole Sears catalog. We did not have every downloaded SKU dealing with every type of mask, every type of gloves. I think we were talking to one person, and I think they had, I don't know, 150 SKUs of the different gloves that were in that environment. Again, we weren't trying to deal with all that catalog environment. We were trying to get this as simple as possible without breaking the bank at the AHC side on the manual manipulation side, because if anybody understands inventory management, if anybody understands SKU control, catalog management, this is a son of a gun to try to coordinate and incorporate into. I mean, that's why procurement systems cost you millions and millions of dollars to be able to handle things like this. We were trying to make it simple. Hey, what kind of mask do you need? What type of gloves do you need? What type of gowns do you need? Do you need medical type of mask? Do you need just cloth type of mask? What type are you really looking for? What's your name? What's your address? And what are the details that you're actually dealing with regarding medical certifications, delivery requirements, special requirements you're having to unload at your facility, the quantity, of course, that you needed within this environment. And I mean, we were getting such things that I didn't even know about, that the electric sector couldn't have the mask with the steel holding strips, I guess, on your nose, on your bridge of your nose, because they would get, they'd have issues with the electricity for the linemen. I wouldn't have thought about that in 100 years, to be honest with you. But there's no way we're going to be able to deal with each and every one of these types of requirements. So you have that special type of requirement, you put it in the notes type of section, and then that gets incorporated into the suppliers that have those types of products, and they can determine if they have those products or not. There is an image that if you have a special image or anything, you can add an image into that set that they can actually see what you are looking for, or any type of other thing that you need, regarding an image within that space. So again, fairly simple, fairly straightforward, and then that gets set. There's a clean customer request here, and that gets sent out to the 6,500 responders that may or may not have. And sometimes you get 5, sometimes you get 6. It's not the ones that everybody has the equipment. That's not the problems the AHC is resolving. You're having a problem because you're going to the AHC because you can't get it within your normal mechanisms that you've dealt with so far. And that is really what we're trying to do here, is solve the issues that you're struggling with on the normal day-to-day activities that you can't find. As you can see, the next thing you get with the list of requests that you have within your environment. Here's the request ID that you get sent out. This happens to be dealing with the category that you're dealing with, and whether it's still active or closed. In over 5 days, we close these activities because we don't want it held out forever so that people are working on these types of requests. And meanwhile, you figured out that you're gonna buy those from somebody, or you're working with 2 or 3 vendors, and you don't need to be having people work, without any results that they could achieve. And then the view of the details, and I'll show you that on the next slide. The next slide, and I know it's tough to read, but bear with me, I'll walk through it. The first column is dealing with the message to the customer and what the specific details are, the quantity, delivery aspects, any type of specific catalog numbers that you need, or anything along those lines. The next one are the quantities and the cases that you need and the types that you need within the particular arena. They provide you the cost that they are providing within this environment. And this is a list of about 10 that I could get on the screen there of the various different types of pricing that you had. And I think anybody that understands these, I think these are, I didn't even look to see. Okay, these are the gloves. I think if you understand the pricing involved with these gloves, anybody that deals with this will know, hey, some of these, 75% of these guys are asking for a lot of money for these types of cases within these gloves, and they're trying to jack it up, and because we're asking for those on an expedited basis, and these prices are fairly high. Well, okay, fair enough. In some cases, though, you're seeing as some of these prices are fairly, probably wouldn't say cheap, but certainly in the ballpark of what you would expect on normal pricing to be for the gloves that you were asking for within that environment. So again, you can kind of see what the competition is, what the various details are, and you can decide if you want to deal with one, if you want to deal with 3, and talk and get down to 3. And I think that this actual result, and you'll just see one of the groups that happen to have the test results, and you can see that you could deal with 2 or 3 of these, and then integrate that piece into your RFP process or your PO processing, and deal with them on a best award type of basis, a BAFO type of pricing within this environment. So there's the pricing, there's the location that they're actually delivering the products from. How far away are they going to be? You can give an idea. They're certainly going to be charging freight instead of airfare on that hopefully it would be, the delivery charges would be lower. When will the shipping be actually be ready to go? What's the next thing? Oh, these are the people's names that they're dealing with, the company's names, the address, the phone number and stuff that they're working through, so that you can move that forward as quickly as possible here. And then the next piece, I talked to you about the closing of the request. And if you think that you're done with 1 or 2 of your of the people that you're going to be working with, you can close out a request so that you don't have people still trying to work on those bids and wasting time when you really don't want them to do that. The vendor settings is quick, as I mentioned to you before. You click that you have sent out your request. The vendors of the 6,700 vendors get their lead alert that this occurred, and they get back to you on, again, what we just spoke about in regards to what the price is, what the delivery was, what are the specifics of the products that they are providing at that point in time, and getting back to you. And like I said, at some of those vendors were probably the first 3 vendors on that list got back within 10 minutes. Now the prices were a little high, but anyways, it just gives you an idea of how fast these things can roll, and especially if you're in dire straits. you'll see what you can get as quickly as possible. If you have a little more time, or you have some collaboration time frame that you can use, you probably can do better regarding that. Just talk to you about the supply form, handling the dollar amount, the shipping location, the quantity available, and then you can begin talking through, how applicable these products are, making sure that it's relevant to what you're trying to deal with. The next point that I wanted to make, and Dan, help me out here because people are tired of me talking all day here. Before Dan talks, I'll just send out this People Incorporated. The Sue Ann Barrett is responsible for her administrative area within People Inc. People Inc. deal with, in New York, they're a nonprofit and deal with around 700 convalescent homes across the state of New York and New Jersey, I believe. And they have helped build and design the buyer interface and website to get this to work through us with a lot of changes. As simplistic as we made it sound, it still, was a ton of efforts that they wanted, to put in that buyer interface. Again, Sue Ann felt, it could be a game changer for us. It's a no-brainer when compared to the time of most organizations. And Sue Ann couldn't come with us today, but again, Dan, I think Dan, if you could help with some of that, how'd you hear about it? How are you using it? What problems has it solved for you? I'd appreciate it, Dan.
Yeah, sure, John. So as I said at the beginning with my intro, I actually heard about this through George Giangi, and we, my county falls in Pennsylvania. There's 67 counties altogether, broken into individual or like groups of task forces where the counties kind of work together, like collaborative training, purchasing power, stuff like that. So we have a 9-county task force that's in our region, and we have regular phone calls on things that we're working on throughout the pandemic and just standard emergency management stuff. So back at the beginning, we realized that there was obviously an issue with PPE acquisitions. We were hearing a lot from our emergency services, especially the EMS folks, that their typical glove vendors were back ordered several months, or they just couldn't place orders at all. So Pennsylvania had put together through DCED a B2B portal where they just went out. If a business had PPE to sell, they could just give their contact information. DCD put it on the state portal. Nothing was really vetted. It was just kind of like a free for all, but it was a good start to reach out and look for PPE. So I took all that information, put it into categories off of their website, stuck it into one of our mass notification services that we use for the 9-county region, and then started using that to try to do something very similar to what is here. And I made that available to all the county EMs within our 9-county region. And I also shared it with the state to help anyone that had PPE acquisition issues. It was very time consuming. It was a lot of work on the back end getting it up to date. Honestly, companies come and go off that list. I have no idea because I don't get notified when it happens. So it's very outdated. But I was talking about some of those frustrations on one of our regional calls. And afterwards, George had reached out to me and said, hey, here's a program that would probably help you out. So we looked into it, and it looked great. And I said, hey, anything that's, all that back end work that I just put in is done for me. So I was all for it. Obviously, saves me a lot of time. And then I was trying to get the task force to purchase an enterprise license with X amount of users for each of the county EMs. And unfortunately, for whatever reason, I guess those Homeland Security funds couldn't be used for that type of a purpose. So I spoke to our director and said, hey, for the, was $1,000, I think it was, for the enterprise license, which gives you unlimited searches for PPE. We could invest that. We bought a couple extra user licenses so I could have 3 people on my staff that can actually do this work now. And I tell you what, the couple times I've had to use it, we've only been on this system for a handful of weeks. And we've had a couple requests that I put through for our county purchasing department and our coroner's office. And took me 2 minutes to put the request in. Responses started coming back, I would say 15, 20 minutes. Now, mine unfortunately went out at the end of the business day. It was around like 3:30, 4 o'clock when I got the information that was needed to put out the specific request. And all night long, my phone email, my work email was beeping, and another person responded, so when I came in the morning, I gave it till about the afternoon. And I went into the system as John was showing in his demo there, and looked at each of I had two requests, one for purchasing, one for the coroner's office. And I could go through and quickly see who had what to offer, if they could complete the order. People were just giving us partial orders that they could do, which is fine, because at some point gloves are going to run out and you might just have to pick pieces from each of the different vendors that have their limited supplies. And I printed everything out, and I sent it down to our purchasing department, and they could make an informed decision on where to go and who to purchase. And it was put in with that, can you do this within a couple-week period? And I would say it's very successful. The downside for me is I've been trying to reach out to my purchasing department to find out who they went with, but they're all working remote, so sometimes it's a long while until I get an email back from them. So I'm anxiously waiting to use it for requests that we would do on behalf of one of our emergency services, EMS, police, fire, the municipalities, and then we can be a little bit more directly involved with that final end of here's who we're going to order from. But I can tell you with that brief experience that I've used it on, it saved me a lot of time, a lot of effort, and even with the service that I put together through our notification system, it still takes quite a bit to craft the message and all the different things that you have to do in the background before it can be sent out to the masses. And I also want to say, I like, if it goes with a problem that it solved for me, when I was using the service I came up with, it just sends an email out to these companies. No one bought into this program that I had put together. They bought into having their information put on the portal for the DCED's business to business portal, but they didn't buy into me loading them into a mass notification system. And when it blasts out an email, and today everything that comes as a blast email looks like spam. So at the beginning of the program, I put a message out to everybody that was loaded into the system at that time, and said who I was, what I was trying to do, where the information came from. And if they have any concern, this is what the email looks like, what it says it's coming from. If you have any concern, here is my professional email address, and here's my office number. That was good, because I think it put a lot of confidence in the folks that were getting the messages that it wasn't spam. But the downside was, and a problem that this here has solved for me, when you use this system here that's being shown to you now, that request is almost anonymous until you are ready to make a purchase and you physically reach out to that vendor. Well, now every vendor on that exchange had my email address and my office number, and we had gone through a pretty aggressive campaign at the end of December trying to spend our CARES money down before it got extended, but before that December 30th original deadline. And we put out hundreds of requests for all different types of PPE. And I spent probably a good 2-3 weeks fielding emails and phone calls of people asking why we didn't choose them for the purchase. Obviously, I felt bad because we couldn't buy from everybody. But at the same time, anyone that's out there knows at this time, we are really, really busy. And I was not mentally or even physically or chronologically prepared to get that backlash of information that was coming back to me from people wanting to know why we didn't choose from them. So I do like that anonymity or whatever that word is to use with the system. And just the biggest thing is time. We are all, everyone in emergency management, anyone that's out there, obviously on the vendor side, very busy during this time. And to be able to just craft out a message and shoot it out in a couple minutes and just wait and get the responses back, compile them and send them to who's requesting it. That, what was taking me a few hours actually brought it down to just a matter of a few minutes. And that was a huge benefit.
Well, Dan, thank you very much. I appreciate it. And like I said, it's not for me to being on the AHC side to try to sell these types of things. It's not about selling, to be honest with you guys. It's about the service, and it's about what can we do to help the constituents. Dan had mentioned the pricing, but basically it's an enterprise license for your organization. $1,000 per year. That's really it. And you get one site license. So if you need other people, if you need 5 other people, it's $100 per each other user that you need. So you would need, if it would be 5 total, it would be $400 more. So $1,400. That's really what we're asking for this type of service. Hopefully that is not very complicated. That's the service. We used to have these tokens. We used to have all this other type of stuff, and it just got so complicated that people couldn't understand it. We couldn't talk it through. So we just tried to make it as simple as possible. So with that, George, I know we're up against the time limit here. We may have a couple minutes. I don't see any Q&As or anything that I happen to see. Is there anything that you're seeing, George?
No, there isn't any, John, but I had a couple of questions, and forgive me, I was cutting in and out during your entire session. So if you address this, my apologies, but are the vendors reviewed or rated for some feedback somehow? Was that discussed?
It's discussed. It's not rated at this point in time. We will be doing that, George. That's kind of Rev 3. As you can kind of see, this is Rev 2 that we have going right now with what we're dealing with the pricing model and everything. But the Amazon, 4-star, 5-star type of thing is really where we want to get to, so that these people that have had good experiences, we want them to remain certainly high on the list. And if they're, if the eBay, gets the 30%, you don't buy from those guys. But that's not in play yet, George.
Sounds good. And John, do you see going forward, expanding this program to include things like generators and plywood and pumps and other things that disasters tend to draw upon?
Yeah, now that we have the exchange service together, and now that we have the process and the application in line, that's not a difficult change. I think we're a heck of a lot smarter now. We still will buy the data services and buy those types of players, especially if it's things that are really unique and that we could gain, from paying a couple $1,000s for the listing that these people provide. They look at that, they get the emails, they get these services together, and they have one job that they deal with that there's no way I could get that many vendors in play. And with that type of cataloging area that we could deal with, or service area or vendor listing that we could obtain with this process, George, it wouldn't take much of anything to deliver different types of parts or supplies as we gain other types of issues throughout the time frame.
Well, guys, thank you very much. Thank you, Dan and John, for sharing your experiences and discussing the program. I really think it fills a void that almost every industry experienced during 2020. And this really has the potential for, like I said, to address a number of disasters throughout the year, not only the pandemic. And it really, I think it speaks highly to the All Hazards Consortium for stepping up again and responding to an industry and government need. Because I think both public and private sector can take advantage of this program. Is that right, John?
No, that's correct. Howard Pierpoint brought up the question with Katrina with the ice. I'm thinking the dry ice could even be a key initiative here in the coming months, especially with these vaccines. So Howard, I appreciate that question.
Very good. I don't see any other questions on the board. So guys, thanks again. Let's give us a few minutes to switch over to the next session, and we'll start at 4:50.
Yeah, there's actually a break here, George. Let me see what we have going. 4:50, moderator, you are correct there, 4:50. So I'll get out of the way here and I'll get the others able to share their sites.
Roger that. Thanks, John. Thanks, Dan.
Yeah, you're welcome. Have a good evening, guys.
You too, bud.